6 weeks ago, Helen Marsh was folding laundry in her kitchen in Ohio. For about 90 seconds, the right side of her mouth went numb. She couldn't hold the dish towel. Her son was in the next room. She didn't call him. She thought she'd slept on it wrong. 6 weeks later, Helen had a massive stroke. She survived. She will never walk unassisted again. Here's what almost nobody tells families. Helen's body gave her a warning, a real one, 90 seconds long, and it vanished so completely, so cleanly, that she genuinely believed nothing had happened. That's the cruelty of what we're talking about today. It doesn't hurt. It doesn't linger. It doesn't look like an emergency. And that is exactly why it steals independence faster than almost anything else in aging medicine. I'm Dr. David Thompson, and before we go further, I want to be clear about something. I'm not here to diagnose you or replace your physician. If anything I described today sounds familiar, this video is not a substitute for a real evaluation. It's a map, so you know what you're looking at if it ever happens to you or someone you love. Because what Helen experienced has a name. Doctors call it a TIA, a Transient Ischemic Attack. Some people call it a mini stroke. I don't love that phrase, and by the end of this video, you'll understand why it's dangerously misleading. There is no such thing as a mini version of your brain losing blood flow. There's only a version that happened to reverse itself in time. Let's throw out the textbook language for a second. Picture the plumbing under your kitchen sink. One day, a small piece of debris gets stuck in the pipe. Water backs up for a moment. Then the pressure pushes it through, and the clog clears on its own. Everything looks normal again. You'd never even know it happened unless you were standing right there watching the water slow down. But here's the question nobody asks in that moment. Where did that piece of debris come from? And is there more of it sitting upstream, ready to break loose? A transient ischemic attack works almost exactly like that clog. A tiny clot, often breaking off from plaque built up in a neck artery, or sometimes formed in an irregularly beating heart, travels into one of the blood vessels feeding your brain. For a few minutes, sometimes longer, that part of your brain is starved of oxygen-rich blood. Your body reacts instantly, sometimes with clumsiness, sometimes with vision changes, sometimes with speech trouble. Then, in most cases, the clot dissolves or shifts position, blood flow returns, and the symptoms disappear as quickly as they came. No damage shows up on a standard CT scan, no hospital admission, no dramatic collapse, nothing to point to. This is why so many primary care visits after a TIA end with, "You're fine now, let's keep an eye on it." Because on the surface, you are fine. The scan looks clean, the exam looks normal, your speech is back to normal by the time anyone's checking. But here's the number that should stop you in your chair. Research published by the American Heart Association shows that after a TIA, close to 1 in 5 people will go on to have a full stroke within 90 days, and almost half of those strokes happen in the first 48 hours. Not years later, not months later, days later, sometimes hours. Think about what that means. Your body isn't malfunctioning randomly. It is showing you, in advance, exactly where the plumbing is failing, and giving you a window to act before the pipe bursts for good. The question is whether anyone is paying attention when it does. I think about a man named Robert, 74 years old, a retired mechanic from Indiana. Robert told me his hand went weak for about 4 minutes while he was tightening a bolt in his garage. He couldn't grip the wrench. Then it passed, and he finished the job like nothing happened. He didn't mention it to his wife for 2 weeks. When he finally did, almost as a joke, she made him call his doctor that same afternoon. The workup found significant narrowing in one of his carotid arteries. He had a procedure to correct it 3 weeks later. Robert didn't have a stroke, not because he was lucky, but because someone finally took a 90-second episode seriously. That's the difference we're talking about today. Not luck. Attention. Now here's the part your regular doctor's appointment probably won't have time to cover in an 11-minute visit. Most people picture a stroke as dramatic. Face drooping, someone collapsing to the floor, an ambulance racing down the street. TIAs are quieter, sneakier, and they mimic things we've all been trained to dismiss as just getting older or just being tired. Warning sign number 1, episodic clumsiness on one side of the body, not chronic, not constant. A sudden, brief loss of coordination, dropping a coffee cup for no reason, a foot that won't lift a stair the way it should, fingers that suddenly can't manage a shirt button they've buttoned 10,000 times before. It lasts 2 minutes, maybe 10. Then it's completely gone, and you feel embarrassed rather than alarmed. You might even laugh at yourself. That embarrassment, that instinct to brush it off, is exactly what keeps people silent, and silence is what allows the underlying problem to keep building. Warning sign number 2, the curtain drop. This one is unforgettable once you know what to call it. Some people describe it as a shade coming down over one eye. Vision in that single eye dims, blurs, or blacks out entirely, like someone slowly pulled a curtain across it from top to bottom. It typically resolves within a few minutes, sometimes less. Because it only affects one eye, and because it corrects itself so completely, people assume it's just eye strain, or a symptom of getting older, or a sign they need a new glasses prescription. It is none of those things. It's called amaurosis fugax, and it means a clot briefly blocked blood flow to the retina, the same blood supply that connects directly to circulation in your brain. Warning sign number 3, momentary slurred or scrambled speech. A sentence comes out wrong. Familiar words get tangled or swapped for the wrong ones. A spouse might turn and say, "Did you hear yourself just now?" And 30 seconds later, maybe a minute, speech is completely back to normal, and you both laugh it off as a slip of the tongue. Here is the pattern I need you to hear, clearly, because it's the single most important idea in this entire video. All 3 of these vanish in under 5 minutes, sometimes under 15. And that disappearance is precisely why they're so lethal. Our brains are wired to dismiss things that resolve on their own. If it went away, we assume it wasn't serious. That's a completely reasonable assumption for a sore muscle or a headache. It is a dangerous assumption for your brain's blood supply. With a TIA, the opposite is true. The symptom resolving isn't your body telling you it's fine. It's your body telling you that a clot moved this time. There is no guarantee about next time, and there is no way to know in advance whether next time the clot will move on its own or whether it will stay lodged and cause permanent damage. Now I want to pull you out of the fear, because fear without a plan is useless, and I didn't make this video to frighten you. I made it to hand you a plan you can actually use. Here is exactly what to do, written down clearly, so you can screenshot this section right now and keep it on your phone. If you or your spouse experience any of these symptoms, even for 60 seconds, even if it's completely gone by the time you think to mention it, use the acronym FAST. F is for face. Ask them to smile. Does one side droop or fail to move the way the other side does? A is for arms. Ask them to raise both arms out in front of them. Does one arm drift downward on its own? S is for speech. Ask them to repeat a simple sentence back to you. Is it slurred, garbled, or strange in any way? T is for time. If you notice any of this, even briefly, time is everything. Call 911 immediately. Do not drive yourself or your spouse to the hospital. Do not decide to wait an hour to see if it happens again. Every minute matters more than you think. Here's the piece almost nobody tells patients, and I want you to remember this phrase specifically because it can change the outcome of your entire visit. When you get to the emergency room, ask directly whether they are performing a diffusion-weighted MRI, not just a standard CT scan. A CT scan is fast and useful, but it can miss the small, early changes a TIA leaves behind. A diffusion-weighted MRI is far more sensitive at catching what a plain scan misses, and identifying those changes can meaningfully change how aggressively your care team monitors and treats you afterward. Then, in the days and weeks that follow, push, kindly but firmly, for your doctor to evaluate the arteries in your neck with an ultrasound and to check the rhythm of your heart, often with something called a Holter monitor worn over a day or two. In many cases, a TIA is caused by narrowing in the carotid artery or an irregular heartbeat like atrial fibrillation, and both of those underlying causes are manageable once they're actually identified. Manageable doesn't mean disappear on their own. It means found and treated before they cause something permanent. This is not about living in fear of your own body. It's about respecting the 5-minute warning it might one day hand you, and having the presence of mind to act on it instead of explaining it away. If today's video gave you even one piece of information you didn't have 20 minutes ago, type the word vitality in the comments below. I read every single one, and it genuinely helps me know which topics matter most to this community, so I can keep making the content that actually protects your independence as you age. I'll say this plainly, because your health deserves plain language, not vague reassurance. Nothing in this video is a diagnosis, and it doesn't replace an actual visit with your primary care physician or a neurologist. Every person's medical history, medications, and individual risk factors are different, and only a doctor who knows your full picture can tell you what your specific symptoms mean. If you ever experience anything like what we discussed today, don't wait for a video to confirm it for you. Call your doctor or call 911 immediately if it's happening right now. Your independence isn't protected by ignoring your body's warnings. It's protected by listening to them early, before they have the chance to become permanent. Take care of yourselves and take care of each other. I'm Dr. David Thompson. I'll see you in the next video.